let's talk about very serious issues. And stuff that we've been talking about on this show, just again and again and again, raising the issue about mental health. Now, I've often been of the view that when we talk about having so many young people having mental health problems, when we talk about kids undergoing the normal stresses and strains, for instance, of teenage life, that we overplay it and over-egg it. And I don't think that everyone has a mental health problem. I think that's a load of nonsense. However, it's undoubtedly the case that the lockdown policies over the last year have had an absolutely horrific effect on adult and child mental health. And according to the Royal College of Psychiatrists, the number of children and young people referred for mental health help has risen by more than a quarter during the pandemic, as children have borne the brunt of the crisis. Almost 400,000 children sought help for mental health issues during the COVID pandemic. Let's talk about this with Jon Goldin. He's Vice Chair of the Child and Adolescent Faculty at the Royal College of Psychiatrists. Good morning to you, Jon.
Morning, Julia.
These figures are absolutely heartbreaking. I just can't imagine what these poor children are going through, but also what their parents are going through, because this is one of our biggest concerns a lot of parents have about their youngsters. But it shouldn't be a surprise to anyone if you stop children from going about their normal life, unable to play with their friends, hang out, do sport, be outdoors, go to school, have a routine. You shove them in front of a screen for months and months and months on end. Is it... And tell them, everyone around you is dying. Is it any mystery that so many children have struggled mentally?
Well, I think it's been a really tough time for young people over the last year or so. The pandemic's created loads of uncertainty for children and young people. As you say, they haven't been able to go to school, and there are public health reasons why the government has limited that, important public health reasons. But it's good that schools have reopened, because, schools are protective factors for young people. They have relationships with their peers, their teachers keep an eye on them. They have a lot of support through schools. They're not doing exercise or team sports during the pandemic. And they're also very worried about their futures. They see a lot of job losses. Most of the job losses have been in under 35s. So they're really worried about the disruption to their normal routines. And of course, family and sometimes grandparents have died of COVID, so they've had losses to deal with as well. So lots of stresses for young people in general at the moment.
Absolutely.
Fortunately, it's improving somewhat at the moment.
Well, I think kids going back to school, I think, was just a magnificent thing. My daughter's coped absolutely brilliantly. We've had a great school, and we've got a happy family background. But even she, I could see the difference in her the day she went back to school. Just sort of the relief and sort of the I suppose just the enjoyment levels, being excited about life again. And this is it. We know that we saw, didn't we, in terms of domestic abuse in homes, and a lot of the problems that a lot of children with mental health problems have as a result of seeing horrific abuse or experiencing abuse in the home and not having that escape from it at school, and also not being rescued from it, from parents using alcohol or drugs, or being physically or sexually abusive, or just, not just, because it's not just, but mentally abusive as well. That often it is school where they go to get that help, to get that respite, where it's the teachers and others who clock that something is going wrong and reach out for that help. So a lot of the children coming forward now, would it be the case that actually some of those, unfortunately, it's taken them a year to get there?
I think that's sadly true. As I said, schools are very much protective factors. And I think the pandemic has exacerbated socioeconomic inequalities. So for some families that might be more well off, they might have really enjoyed having both parents at home, able to work from home, more family time, quality time, sitting around the dinner table together in a way that they might not normally do. But many, many families that do suffer from socioeconomic difficulties, the parents might have lost their work. They might be under huge pressure financially, not even have enough money to feed their children. And that, of course, exacerbates conflicts at home. And as you referred to domestic violence, sadly, in terms of safeguarding, a lot of difficulties have gone under the radar over the last year or so during the pandemic. And as you say, now that they're back at school, perhaps things are being noticed in a way that they haven't been noticed for the last several months.
I wonder how much, even leaving all of that aside and in no way thinking it's not unimportant, how much just children seeing non-stop miserable news about lots of people dying and how terrible the world is, in so many different aspects. We get this sort of diet of negativity and death and destruction, and the kids sort of sitting on their screens all day and hearing this news all day. That this has got to take its toll on youngsters whose knowledge of the world is still forming, and this sort of unremittingly sort of negative outlook that we've seen. It takes its toll on adults, so no wonder it would take its toll on children.
Yeah, I think we need to be careful not to sort of overdo it, really. I mean, the
Mm.
24/7 news cycle, as you referred to, is very difficult for young people if they're constantly seeing things about death and uncertainty about the future, etc. On the other hand, I think it's really important to be honest and open with young
Yeah.
people that it is a difficult time, that we do need to be careful about wearing masks and things like that, and explain the reasons for it. So there's a kind of balance to be struck. But yes, if they're kind of on their screens all the time and looking at negative news, that's certainly detrimental to their mental health. So that needs to be balanced. And I think it's important to be a little bit optimistic as well. Although we do know that referrals to sort of CAM services, for example, have gone up by about a third over the last year compared with the year before. And we do know that there are serious mental health difficulties amongst young people. I don't think we should be full of gloom and doom and pessimistic, because people do recover and young
Yeah.
people are resilient as well.
Yes.
So I think we need to be, balanced about how we look at this.
Hear to that. Thank you so much for joining us. The Royal College of Psychiatrists, Jon Goldin, who's Vice Chair of the Child and Adolescent Faculty. Thank you for that.